Welcome to the business of allied health, supported by Cliniscribe. I have a very lovely VIP guest today. Finally got a hold of him. We've got Rob LoPresti. He's the APA CEO. Welcome.
Beautiful. Thanks so much for having me, Barry. Looking forward to having a chat with you.
Yeah, I just wanted to learn more about yourself. The people I know don't actually know that you're even a physio in the
Yeah.
past. So tell us about your story and how you ended up being the CEO of the Peak Body.
Yeah, no, beautiful, Barry. So I went through Melbourne University as a physiotherapist and like many really explored all avenues of physio as you're starting out. I got my first job at Austin Health. So don't know it, it's in Victoria, one of the major metropolitan hospitals there, and really enjoyed that experience working with the hospital as part of that team, all aspects of physiotherapy. And I landed in a spot that I didn't necessarily see myself landing when I first started. And that was as an ICU physiotherapist. And I just loved the challenge of working in that environment in intensive care. And I probably did that for maybe around 6 or 7 years in that space. But while doing that, I developed a bit of a passion around the education side of things. I really loved having students, having that responsibility of supervision and all of those sorts of things. And an opportunity came out across at Melbourne University, working within the program over there. And that role was as their clinical education manager. And I went across, moved out of clinical and still did weekends as I was going. So I wasn't quite ready yet to give up on the clinical side of things. But that role gave me really good insights into the challenges around clinical placements as they face in the importance of getting that experience as part of your program. Back then, there was really just Melbourne Uni, La Trobe and Monash. So I'd hate to see the role of clinical placement managers today because there's physiotherapy everywhere in terms of all across the university. So a more challenging space, and happy to dive into some of those aspects a little bit later. And then while I was there, I did a master's of management because I wanted to see myself broaden out and move into more leadership type roles. I did a role as a director of interprofessional education at Melbourne Uni for a while. And their role came up at Austin Health, which was the director of education. And so that gave me an opportunity to go back to a place where I worked clinically and I really enjoyed working there. But it started to move me in the direction of my career slightly beyond physio. And so I had responsibility of all the pre-vocational training for medicine, all of nursing education, all of allied health education. Was a real multidisciplinary unit there at Austin. And then probably did that for about another 6, 7 years. And then again, moved into probably my first more high level, extensive executive level role. There was a national role, and that was my role before the APA. And that was at the Royal Australian College of GPs, and that was as their chief education officer. So that had the responsibility of training the thousands of GPs right across the country, but also gave me really good exposure in terms of professional body and organizations, because there's a lot of similarities between how you advocate for a profession, what good membership services look like, what good education programs look like. And so that gave me a really good further foundation from that perspective. And then it finally just almost feels like full circle. I remember the day that I saw the role come up and I thought, what better opportunity in terms of my first CEO opportunity to come back to physiotherapy and be able to contribute everything I've learned along that journey and bring that back into this role. And I've been in this role now for 2 years. And I think being able to have that understanding of going through it, as well as the experience of branching out for disciplines beyond physio, has helped certainly put me in good stead, and certainly helps having that passion for the profession itself, having been part of it myself.
Fantastic. Just a quick question for those kind of early career people that want to follow a similar path to you. What tips would you give? Where did you learn your leadership skills or interest? And do you have any mentors?
Yeah, no, great questions. And I think some of the tips I'd have is just to be open to things and new experiences, and don't be afraid to put your hand up for things and to really get involved. So like I said, I didn't really expect that I was going to be an ICU physio. I probably started out, I enjoyed my sport like many others and pictured myself maybe being a sports physio or working in a musculoskeletal practice and maybe owning a practice one day. But that experience in hospital sort of took me along a different path. And I worked along some really great people in there. I mentioned key people and learning. Sue Burney was probably one of my early managers, who was the director manager of Physio at Austin Health, has recently retired. They're a big heavyweight in research in their own right. And taking students more on and volunteering, I took on the education program to support in-house in-services for junior staff when I was there. And that sort of led to that passion of education. And then forming some networks, branched out to forming good connections with Linda Dennehy's, Professor Linda Dennehy at Melbourne University. And she was there at the physio department when all that opportunity came up. And so I think it's just put your hand up, get involved, and be open to lots of different experiences. And in terms of the leadership side, I think it's about taking some really good traits that you see from different people, but ultimately you've got to lead with authenticity yourself. People, if you try to mimic someone else and their leadership style, I think you'll lose that authenticity that comes in with it. And I reckon it's really important to take learnings, but then think about, okay, how do I apply this as me to make it really unique and authentic?
Love it. Thanks for that. To today's topic, what are the biggest challenges are you hearing from private practice owners
Yeah.
as members of the APA?
Yeah. And look, there's a number of challenges at the moment, but I think the biggest challenge is around running a really sustainable business. And this is an environment where we're seeing costs rising and the funding streams just aren't keeping up around it. We're not seeing the indexation that we'd like to be seeing around these things. One part of government's not really talking to other part, because in one part we're looking at how do we increase wages, which really was something that needed to be addressed, particularly in the HPSS award. We know that many practices were paying well and truly over and above as part of that, and there needed to be a catch up. And there was a lot of gender inequity that sort of sat in as part of that. And so it was an important thing to do. And it brings it closer to where practices are probably paying, but there might be some challenges in terms of how that increase is going to be implemented over this 5-year period, because it's fairly significant. So on the wage side, which is probably the biggest cost driver, there's that challenge. But on the other part of the funding, we're not seeing that increase in the same way. And when I look at the various areas, NDIS has been a really hot topic around things. And last year, we saw Physio actually get a rate cut, which was almost unfathomable, to be honest, around that. And something that we fought really hard around, because it just made no sense in terms of the rationale that was coming out, in terms of the why. And I can talk a bit later in terms of the advocacy and specifics around that, but there's lots of challenges there. We're seeing thriving kids at the state level and what that's going to look like. In aged care, huge changes around support at home. DVA fees, while we had a win recently, which was great to get an increase, there's still challenges around the cap and what that kind of looks like, but that's been long overdue. And we're really pleased to at least see the rate increase, which will come in next year. There's lots of opportunity, I think, around private health insurance and rebates there. And that's a real focus area for us, because I think Physio has a great path to play in terms of what we can do in private health. And then you've got all the state compensable schemes. So a private practice is operating in this environment where patients are coming in from various schemes, and every private practice would be built up in various mechanisms. Some might be NDIS heavy, some might only have a 5-10% part in NDIS, some might be heavy in compensables or not, but they're not seeing the indexation we would like to, and pricing and funding is a major component around it. And it shows the patient mix and not having your eggs in one basket is as strong as ever in private practice. So I think that whole funding pricing is a really important area, one that we're driving really closely. I think workforce is another one. And so how do you really recruit and retain really strong staff? We hear a lot about work readiness, transition to practice. And so I think there's lots of things we could talk a little bit more about in there. I've talked about the wage pressures that are sitting there. The career pathway is a really important one, and what that looks like, and reward for those career pathways and levels and remuneration. And another one that's emerged a bit in workforce in the last couple of years is a bit around the Trans-Tasman mutual recognition arrangement that sits there. And that's created an influx of people from overseas who are almost bypassing New Zealand, coming straight to Australia. And so how do we make sure that they're still operating at the same levels we'd like to see across the workforce? So I think funding, workforce, I've talked about business viability. Probably the last challenge I'll say is this just environment of general constant feeling of change. I think we'll probably touch a bit around AI. It's hard to avoid that conversation as part of it. the regular changes, the fair work changes, and then you've got this evolving patient expectation that sits there. Now more than ever, patients are well informed. They've got AI, they've got at their fingertips. So they're coming ready with their own sort of thoughts around things. And we're operating in a space where there is increased competition and some blurring of scope, depending on which sector we're in. So whether it's some overlap with OT, say in NDIS or exercise physiology, or from the consumer as why physio versus OT or chiro, there's that sort of environment as well.
Interesting. I guess basically, it sounds like you do a lot of work behind the scenes.
There's a lot going on. Yeah,
And
that's for sure.
unfortunately, a lot of it doesn't. I've worked on your end too, and a lot of it doesn't get recognized because people only see the actual outcome or the win.
Yeah.
So yeah, it's very interesting that you're working on all these complex issues and it's hard to press forward, but you just got to keep going with it.
Yeah.
So what is the biggest practical value you think the APA can add to private practice over the next few years? So we know you're doing all this advocacy stuff.
Yeah.
What else do you
Yeah.
feel definitely that you can offer now? And I think we talked a little bit in our groups around education.
Yeah. Yeah. And look, we launched our strategy last year, which is our sort of towards 2030. And really there's four main key pillars as part of that. Advocacy is one, and we could talk all day around advocacy, and I've given you some insights around some of the work there, give other examples, but education is another really core pillar that sits there. Education, not just about the PD and things that get delivered there, but what's that career pathway look like? And what does achieving elements of that career pathway bring for you in terms of recognition and reward throughout the journey of the career as well that sits there? So education is a really core pillar. And that's the first time we're bringing education to the fore a little bit more at the APA rather than being sitting in the background. Membership and experience for members and how we bring together networking, coming together, a sense of shared identity. That's experienced in a number of ways. We've got a huge bank of volunteers that come through, and they're so valuable because what we do, and I always say to our team, if it's not resonating with members, if it's not coming from importance for what members are telling us on the ground, then we're not working on the right things. And we get that through our extensive membership network that we have, through our national groups, through our state-based committees. All of those sorts of things really feed in important. And then there's other things where we bring people together through conference and those sorts of things that sit within all of there. And then the last pillar is just how do we have the right systems and the right people internally to be able to deliver on all of those sorts of things to set us up for success. So, in terms of what we can practically do, it's how do we bring the right evidence, the right policy insights? How do we provide businesses with that business intelligence and actually really practical guidance and bring professional credibility overall to things? And how we've done that, I think, is some recent examples. And often government like to see not just what we're saying, but where's the evidence behind it? And we've invested really heavily with NOUS on a number of key documents. And I think one key foundational one that's been sitting there in a pipeline for a while, but we brought out last year was the research now did into the sustainable hourly rate for physiotherapy and what that means, because that's a real independent piece of research that sits there that looks at, if we want our practices to be sustainable and to deliver the value we know that physiotherapy can bring, then this is what that recommended rate should start to look like. Because we often hear, where do we start? Where do we look? And I need to also make it really clear that this is not the APA setting a price that sits within it. This is independent research, putting that research out there for people to make their own decisions on where that sits for their practice. But I think that's an important starting point.
Yeah.
We'll start to then build on that and index it appropriately. But we leverage it not just for people to have evidence to make decisions for their own practice on, we tie that in with our advocacy. So when we were talking to the NDIS, compensable schemes, all of those sorts of things, this is highly utilized. And if I refer to one profession where they've used this successfully, psychology have had this for a number of years. And it may not be too much of a shock then. And when we look at NDIS, they were one of the big winners that came out in terms of a fee increase. And I think having this sitting there in the market, they've probably had it for nearly 10 years now. It takes time for everybody to start to get to the level that needs to occur, but we can see the light at the end of the tunnel and they're starting to see it. So that's one example. We've also used NOUS for the economic value of physiotherapy, because we know physio is effective. We've got so much evidence out there. We're one of the most highly evidence researched professions in allied health. We know what we do is effective, but how does the costing around that work? How does that translate into economic value? They're the arguments we need to make more and more of in terms of our submissions and cut through around things. When the NDIS thing landed, we went really heavily in terms of the methodology and refuting that methodology. And while I was actually a bit disappointed that evidence from NOUS didn't translate into a physio, at least reverting back to previously before the cut, but ultimately we want to be extending out further like psychology, there's acknowledgement of the fact that some of the findings are coming through, but I'm actually meeting with the NDIA again in a few weeks to continue that fight around it, because I still don't think it's effectively been taken on board. So there's a few other examples of things that we're working on, but I'll probably say one other just practical thing, because I know we're talking to the business groups in particular. One of the key ones that I hear about is joining the business group and the premium principal tier. And I think if there's one piece of really practical, value-driven advice, I often hear from people the amount of investment to actually join that group and what you get out of it in terms of the products like HR and practice through Wentworth is far and away more than what practices are paying than if they were doing that independent HR advice and things from other sources. So I think if people don't have that now, that's one that we consistently hear is really valuable. And then how we bring those other reputable resources like Morris Blackburn Lawyers, we've got Inspire Accountants, we've got Manpower Group for recruitment, other things like Vista Print that have come out and to help with other needs. So we're trying to partner with organizations that can bring value to members for the things they're using on a day-to-day basis. And then there's other practice management software like Clinicos and all of those sorts of things as well.
Excellent. I love that response. There's a lot of stuff there. All right. So into now my area is AI and technology. How are you guys supporting the members in adopting this safely, ethically?
Yeah.
Even as you're even aware.
Yeah. And look,
on acceleration mode now.
Yeah.
More than ever before.
I think the first thing is not to see it as the threat, but see it as the opportunity. We have to embrace it. We can't put our heads in the sand around it. But how do we do that appropriately, ethically, as you say? And look, one of the first things, and you're well across this because you sit in this group, I wanted to bring together the best people around to come into the APA and help us to develop this out so we can help our members. So we formed an AI advisory group with people like yourself, and we've got academics, we've got people from legal, we've got people from all key areas that come in to formulate that group. And one of the things that we first worked on that we'll release really shortly to the membership is, okay, there's position statements that sit out there from APRA and the like, but from a profession point of view, where's the APA sit in terms of a position statement around AI? And this is born out of the work of that group, and we'll release that really shortly. And that's really high level principle based. Where we want to go to more next is where does those principles translate into really practical, useful, on the ground pieces of work. As part of our conference at Focus coming up in Cairns, we've got a half-day workshop, which is already getting really good numbers into it that's focused around AI that sits there. I want us to start to do a real education series that will come out for our members, and that will be free to join for our members to be part of that as well. And then ultimately, we'd like to see further resources, guidelines, toolkits that sit in as part of it. And we're also working on who do we partner with in this space, because that's the other key element. Who are those reputable partners that we can help guide our membership along with, so to provide them with trusted advice of who they may look to work with as well.
That's a really interesting area, isn't it? Where people are vibe coding and using tools like Claude to build their own apps now.
Yeah.
A bit of a blur there. And I think for you guys, reputation is everything, isn't it? You don't want to go with the wrong provider that ends up.
Yeah. And that's where I think it's where we can add value as a professional body, as a support, to be the trusted advice, where so that people aren't out there individually going, where do I start with this? Who do I go to? What do I need to think about? They can go to the APA and we can help guide them and work their way through those things.
Yep. Yeah. Just on that note, great initiative there, Rob. I think it has been very valuable as a volunteer myself, but the things we're really doing there, and even our last discussion, which I won't reveal, but related to your own interest, around
Yeah.
education. There's a lot of things we can do there too. So an
Yeah.
exciting space to be part of. All right. So last question before we wrap up. This is a really critical one because I see
Mm.
some people are on the fence. You know how it is. It's like a church
Mm.
where some people are criticizing, some people are positive about the APA.
Yeah.
What should members realistically expect from the APA and
Mm.
what should they not?
Yeah.
I think this bit is where it gets a bit fuzzy and opinionated. I've seen in the social media groups. I'd love
Yeah.
to hear your authentic response on this one, which I'm sure.
Yeah. Yeah. And look, I think what you should expect is really strong advocacy for us and advocacy on the right issues, advocacy that matters for the members in terms of what we're representing there. They should look at us as that really trusted, reputable organization that is representing them. Physio is only going to make the gains that we need to with government funding if we're a really united group. And the more united we are around that and the more we're able to support each other on that journey, then the better we're able to be. And this is where membership around APA is so critical because we're only as good as the members that we have. And that is all invested in us being able to build capability to drive the advocacy that sits there. And so members should see us as being that representation of them to act really honestly with timely communication and have that long-term vision for the profession. So I think that's what people should expect. And it shouldn't just be pay my membership and value just because I need to give back. We need to give good value that sits in there as part of that. And hopefully I've talked a bit about the things that sit there from value, not just around advocacy, but things in education, things around, we haven't talked about insurance yet, but I think we've got the best in breed insurance that sits there. Insurance is an absolutely critical part of what everyone needs that sits in there. And we negotiate to make sure that it's best in breed so people can feel really assured as part of it. So I think there's some of the things to expect. In terms of the things to not expect, and I think the thing is, I wish it was as simple as going, we've got a great idea and government, if you just do this, the healthcare system is going to be better. And I wish it was as simple as being asking for things and clicking our fingers and making it happening. But just because we've got great ideas and sometimes great evidence, it doesn't guarantee that we're going to get the success around it or not immediately. One of the things I hear a lot of people that work really closely around government, politics and things is from the idea generation stage to actually getting outcomes can often take 10 years around that. And that's not things that any of us want to hear. But when you actually look at it and see and branch back, and that's why experience from RACGP also, I think general practice right now is getting some really good exposure, some really strong funding. But let me tell you, when I was there probably 5 years ago now, that was not the case. That is built over time with sustained messaging.
Even for GP.
Sometimes sometimes it's the timing that sort of sits there with things. And sometimes there'll be things like, why aren't we asking for this? Why are we going for that? And that can be things around timing and opportunity and what's the government's agenda of policy windows and funding elements. So those things are pretty key around things as well. So I think it's just, believe me, I want the wins and I want them now more than anyone. And we're trying really hard to get those. And I get just as disappointed as anyone, particularly when we've got the great case and the evidence. But I want our members to feel reassured that we are absolutely fighting really hard in all of these spaces and we'll be quite relentless around it. And the only other thing I'd say is I think it's a great thing for our profession, but it's also one of our biggest challenges from an APA perspective. And that's the fact that physio operates across all sectors. We've talked a lot about private practice today, but hospital physio is a whole other area that we could have a whole other half an hour on in its own right. But we're across all sectors. We're across all parts of the lifespan, from birth and pediatrics right through to gerontology and end of life care that sits there. We've got 20 national clinical groups. We work across musc, cardio, neuro, all areas that sit within there. And that's terrific that we've got such breadth that sit there. But when it comes to advocating, providing great education across all of it, that becomes pretty challenging in terms of how we give everyone the right level of effort at the right time. So I think that's just one of the things that's difficult, but I love the opportunity. I wouldn't have it any other way also. And I think that's one of the things that I love about the role and in driving us forward for the profession as well.
No, I love it. I love the fact that you said it's 10 years. That's a fact, basically. And the fact that you're a physio means not just your tenure as the CEO,
Yeah.
part of your identity, meaning
Yeah, it is.
there
Yeah,
is
it is.
skin,
You know,
emotions.
Would I get as passionate and involved if I was sort of CEO for one of the other
Yeah,
disciplines?
if
And
you,
yeah, I'd want to be doing great things as part of the role and all those sorts of things. But I have this incentive as well because I know the skill set we've got. I know the training we go through. We've got some of the best and brightest people coming through to study physiotherapy. And I know it's an untapped element of what we can do and achieve. The opportunity we've got ahead is to get the funders to see and recognize that. And I'm confident one day we'll get that and we'll get there. We're making more and more inroads around things like referral rights to specialists and those sorts of things, but improving hospital wait lists around surgical and then avoiding surgical interventions. We haven't started on prevention and all those things. This is where physio can really take the lead around that. So I'm real keen. I think there's a bright future, but it's not a quick and easy one. That's the only problem.
I love it. I love it, Rob. I can relate to that. As I said, I've been down the software engineering path and I came back. Not that I had to, right? Because the market's not as big. Do you know what I'm saying? But it's my identity. So I think there's this kind of ultimate responsibility of passing on that baton.
Yeah.
And leaving your part. You know what I'm saying?
Yeah,
To the
absolutely.
next generation. No, thanks, Rob. Love that. Thanks for being on.
No worries. No, and thanks for the opportunity. It's been great. And thanks for all the things you contribute as part of your time to the APA as well, Barry.
I'll do my best. Thank you. See you.